Another extremely high yield topic for USMLE, PLAB and each PG is Clesrovimab. Again MAB, so it is a monoclonal antibody. You can identify it by the suffix. Clesrovimab C4. This is what it is. It is a respiratory syncytial virus monoclonal antibody used for infant prophylaxis. This is very important. Used for infant prophylaxis. Let us come to know what it is. Again, this is a fully human monoclonal antibody, fully human. So if it is fully human, then very less chances of any adverse reactions. You know, chimeric antibodies made from rats and other, but now we have fully human monoclonal antibody. And which type of it is? This is extremely important. Immunoglobulin G, 1 kappa. Okay. What does it do? That is very important. It targets respiratory syncytial virus F protein to prevent infection. This is an MCQ high yield, USMLE, PLAB, NEET PG. So therefore it is used for respiratory syncytial virus prophylaxis in neonates and infants. Neonates and infants. There is a fixed 105 milligram. That is the best part in this. Like in neonates, infants measuring birth weight, we can measure it easily, but the problem is that if suppose we correct wrongly and the infant dies, it's a big problem. So there is a fixed 105 milligram intramuscular dose, regardless of weight. Weight no matter, जो मर्जी उसका weight हो. Then indications and dosing. This was FDA approved in June 25. I told you. Then it is used for the prevention of respiratory syncytial virus, lower respiratory tract infection. Okay, then single 105 milligram intramuscular injection per season. Redosing is done only if cardiopulmonary bypass during RSV season. Redosing done only if cardiopulmonary bypass during respiratory syncytial virus season. After that, moving on to the clinical efficacy, 60.5% reduction in respiratory syncytial virus medical visits observed over a period of 150 days. 84.3% reduction in respiratory syncytial virus related hospitalization and 90.9% reduction in severe hospitalized respiratory syncytial virus cases. This is comparable or superior to palivizumab. Palivizumab is a monoclonal antibody, so you can compare it, comparable, or even in some cases it is superior to palivizumab. Then safety profile, it is generally well tolerated, mild injection site reactions like erythema, I told you, redness, swelling. Erythema is seen in 3.8%, swelling is seen in 2.7%, rash is seen in 2.3% of infants. Very rare it is anaphylaxis. Anaphylactic reaction, very rare, anaphylaxis, and it is contraindicated in the case of known allergy. Then clinical benefits and logistics, weight independent fixed dosing. Best part, fixed dosing, this simplifies logistics. Pre-season administration reduces the healthcare burden. When you know before that season, then long acting protection throughout Respiratory syncytial virus. There is a specific respiratory syncytial virus season. They give good protection, good safety profile with broad access anticipated. Summary. It is a next gen RSV prophylactic, respiratory syncytial virus prophylactic, monoclonal antibody for infants, fixed dose, which is 105 milligram intramuscular, high efficacy in reducing RSV burden. This is expected to improve respiratory syncytial virus outcomes in upcoming seasons. Bye.